Fforwm have just been incredible with me. Having that knowledge that whatever I'm doing is making a difference. The Fforwm are my friends now, and I love them to bits. I have got depression, I have social anxiety and borderline personality disorder. I was 15. I was struggling really bad with my mental health, and my mum took me to the doctor. She saw that something wasn't right. All they did was put me on a load of antidepressants and said that there we are, go and get on with it, basically. I just wanted to get away because I thought people were, I thought nobody wants you around. Even if you weren't here anymore, nobody needs you. I felt like, well, why are you even here? I used to go clubbing a lot, did drugs, sleeping about. In the clubs, I was always first in and last to leave. I didn't realise what was happening, and it just went on for years. I went through a phase of being manic depressive, and I crawled into bed, and I was very suicidal. I had this kind of light bulb moment, but I felt like something was going to change. Joining the Fforwm was, I think, was the biggest thing, simply because they knew what I was going through. They knew, and knowing that I'm not alone. Just being part of a society that is making a difference to people with mental health. What I'd like to change is early intervention. Early intervention is vital. If I was given the help I needed when I was 15, that wouldn't have happened. I'm passionate about the fact that professionals need to have a bit of empathy. Treating people like human beings doesn't cost anything, because I've dealt with a lot of professionals before, and all they're concerned about is tick box. We've said this in a number of professional meetings with a number of health boards. Just treat people with mental health with a bit more dignity and a bit more respect, because we're human beings. I hope people feel that they know that I'm there to give something back. More people need to join because the Fforwm is vital.